We begin with fast-moving developments about the coronavirus, including the first reported death in Canada. An elderly man in British Columbia, a resident in a care home, has died of COVID-19. It was a deadly turning point for public health in the country.
The finger pointing began as soon as the bodies started being carried out of the residence.
31 deaths in a couple of weeks. That's something very urgent.
The coronavirus spread like wildfire. Residents were dying in their beds. More than 16,000 long-term care residents in Canada lost their lives to COVID-19. Fast forward to today, and one thing has changed. Thanks to vaccines, the death rate from COVID in care homes has plummeted. What remains a crisis, though, is staffing. There was a shortage before, and the pandemic has made it worse. To get a clearer picture, I met with Karen Biggs. She's a registered nurse and CEO of Menno Place in Abbotsford, BC, one of the largest seniors care campuses in the province. For her, the job isn't just professional, it's personal.
Hey, sweetie, you're going to be on TV.
Karen Biggs has worked in geriatric care for years and has done it all, or she thought she had. Then the pandemic hit.
I can honestly say that in my 46 years of nursing, it's been the hardest time of my career.
So this is Menno home.
It is.
She runs Menno Place, a sprawling campus of 6 buildings that offers multiple levels of care, from independent living to 24/7 nursing home care to 700 people.
Hey.
Including Peter. He is Karen's husband.
Peter moved in here in July, and I had him at home, and I found the care was too much for me at the time.
Peter collapsed 2.5 months after their wedding in early 2020. He had a brain tumor. After surgery to remove it, he got COVID in the hospital. Karen was living a nightmare, trying to keep him and all the residents in the place she worked alive.
It would break my heart when I saw people coming to our windows to wave at their parents.
Everyone went into strict isolation. Some families, she said, complained Menno Place, which long prided itself on being warm and welcoming, became like a prison.
We had to hold families away, which was very hurtful for us and for the families. And we wore the wrath of many families because they didn't understand, why are you not letting us come to see our loved ones?
And what's it been like for staff?
It's been really hard for staff. We had the single site order. We lost 39 staff to that.
The single site order prohibited staff from working in multiple care homes, something that was common before COVID. For 9 months, they held on and kept COVID out of Menno Place. Then, like a ghost, it appeared.
You'll know in those days, we didn't know that it was airborne. And so it started with one resident who came back from the acute care hospital, COVID positive, and we didn't know because she was only there 5 hours. And every 2 days we got another positive and another positive and another positive. And at the end of that one, we had lost 16 dear seniors. It was profoundly upsetting to us because you're so attached to the residents. They become your family. And in those days, we had no visitors. So our staff were the only people that were seeing those seniors. So.
Even when they were dying?
Even when they were dying in those days.
25 staff also got COVID. The shortage was so acute, patient care suffered. Bathing was less frequent. Residents were left in bed all day. Karen, a problem solver, had an idea. Why not hire and pay family members of residents?
I was absolutely desperate because at that time we had an outbreak and we had to put in extra enhanced cleaning, and we just didn't have anybody.
She ended up hiring 9 family members. You went through some terrible times. The staffing shortage still exists?
It got worse. You'll remember, and that's what the protests are about right now, you remember mandatory vaccinations. So we then again lost 9 regulars and 29 casuals because we had people who refused to get the vaccine.
What did some of the staff who refused to be vaccinated tell you about their reasons?
I talked to one LPN at least 10 times myself as the CEO, trying to get her to stay because she was a really good caregiver of my husband.
This is a licensed practical nurse,
Yeah.
right? And she looked after your husband?
Yeah, and she was so kind, and I did not want to see her leave, and she was a single mom. And so I tried every argument in the book. And she said, no, I read something that a doctor in the United States put on Facebook, that it's going to alter my DNA. And I said, well, There's many learned people that don't believe that way, and I would just urge you to read what they've written. But I couldn't convince her. I couldn't convince her that that one story wasn't the true story. I actually support the position for mandatory vaccination because the risk is too great for our seniors. We had an outbreak last September on a unit where everybody was double vaccinated. The good thing is we didn't have people die this time.
What did losing those staff do to care for residents?
Well, it definitely added pressure on all the staff that were left. People work overtime even when they don't want to because they can't leave their colleagues to be working short, and they can't leave the care not to be done. We have a full-time recruiter that we've had for a year and a half now. We've recruited 222 people in the last year, but we're still desperately short.
The hardest to recruit, she says, are not personal support workers, it's nurses. She doesn't think pay is the problem, at least not in BC.
The salaries are excellent. You know, if you look at Kerry, they're making $25 an hour. You know, our nurses are making probably about $55 an hour, and the benefits are amazing.
So Karen, what's the solution here to recruiting?
One of the mandates that we've been pushing in the federal government is to try to make it easier for internationally trained nurses to come to Canada. We have got wonderful internationally trained nurses working as care aides because they can't get the paperwork through to work as nurses here in Canada.
How acute is this staffing shortage more broadly beyond your facility?
Well, it's not only our province, it's national. You know, when I do accreditation surveying in Ontario and Quebec, and Alberta's just in the same situation.
The pandemic, she says, may have scared people away from working in care homes and has burned out nurses everywhere. What would you say to them to make long-term care an appealing career?
The rewards of working with seniors are absolutely immense. If you love people, if you love stories, if you love hearing about the wonderful things that they've done with their lives. We weep when they're sick. We weep when they die. You know, we become their family, and that's a precious, precious gift, you know. Finish having your lunch.
One blessing of having her husband at the care home, Karen says, is that she has him close by every day.
The challenges aren't over, but he's starting to eat, he's starting to talk, and hopefully one day we'll get him walking again. Okay, sweetie pie, I have to go to a meeting. Give me a hug. I know. You know.
She's constantly working on solutions, knowing the need for carers will only grow as we all get older.
Love you.